Good afternoon. My name is Melissa Evans, and I'm the managing editor of the Long Beach Post. I'd like to thank you for joining us today on this Friday, May 1st. So we've been doing these 30-minute live chats every day at 1 o'clock for actually the last 5 weeks, bringing you different voices who can speak to the current COVID-19 pandemic and its impact on Long Beach and beyond. Today we have a little bit of a special program. We're going to slightly deviate from what we normally do. We are pleased to have with us today Long Beach Mayor Robert Garcia, as well as Congressman Alan Lowenthal, who represents most of Long Beach and parts of OC and also Catalina. So we're grateful that both of you could join us today. Today's program will be a little different though, because we're really going to focus on your questions. So this is your chance to ask your questions of two people who have a pretty significant hand in the city's navigation through this health crisis. We are taking questions on the comment feed of our Facebook and Twitter accounts. This is also being broadcast live on our homepage. I've asked the mayor and congressman if they could to please keep your remarks as succinct as possible. We only have a short amount of time. We want to get to as many questions as we possibly can. And also for those of you that have questions, please keep your questions to broader areas that might impact large groups of people. If you have more specific questions, we'll do our best to point you to resources where you can get answers. So with that intro, I want to get right into it. Let's get started. And I want to start with the same question for both of you. It feels like we're in a new phase of this health crisis. We kind of shifted from the crisis mode to when are we going to reopen? When are we going to get back to normal? People are angry right now. Or groups of people are angry. They want to either worried about their financial well-being. They're worried about whether they might be able to survive this. And I want to ask both of you, starting with Robert, what you've been hearing from constituents and how you've been responding.
Sure. I mean, first, thank you to the Long Beach Post for hosting this. It's always great to be in any type of town hall with my favorite congressman, Alan Lowenthal, who's obviously been a longtime leader for our community ever since he was on the council, a professor at Cal State Long Beach. So thank you, Alan, for doing this with the Long Beach Post, and the Long Beach Post, thank you for hosting. Mm-hmm. I would say that we get that people are angry right now and scared and anxious, and all those things are normal. We are undergoing which probably one of the larger crises that this country has gone through, but certainly that Long Beach has gone through in decades. I mean, when you look at the amount of folks that are losing their lives, certainly people that are unemployed, the businesses that are being affected, families that are being affected. This hasn't happened to the city in decades and decades. And you can compare this to impacts we had in the 1930s, or during the Great Depression, and it is significant. So we understand that it is a huge issue for us in this community. What we're trying to do is to lead with facts, with data, with the science, and putting out front all of the best medical advice that we're getting, not just here locally within the Long Beach Health Department, but our partners at the county and the state, and the CDC. And I think we're all in partnership trying to get information out. We're making decisions based on the facts. And sometimes the data and the facts aren't what everyone wants to hear. And I understand that, but that is how we're going to lead, and how we're going to lead through this crisis and this recovery. I get all types of information from people. Why are you responding this way? You're giving me too much bad news. Why can't you reopen? And at the end of the day, this is going to be done in a way that's scientific, and that is done in a way that we're listening to the medical professionals. And so that's how we're going to respond to this crisis. And it's still a crisis and still a serious issue.
Thank you. Alan?
Well, first, I agree completely with the mayor. And thank you, Melissa, for having me on. Maybe what I can add to that is a little bit of a national perspective, in that I am really glad to live in California for many reasons. One of that reasons is that our leadership, both from Mayor Garcia to the county level and the city of Los Angeles and our governor, really have put the interests and the health and the safety of our residents first. As the governor points out, he started 23 businesses before, so he is committed to opening up businesses in this state. He has a plan to open up businesses. The mayor now has a task force to figure out, but we're going to do that in a scientifically sound way. The CDC presented to the president a number of guidelines and what you needed to do for a state to open up. These were only suggestions. Many states violated that. They didn't really want to be based upon the science. They didn't feel like that was the most appropriate way. The pressure from their residents was so great. Now, I agree. People are in pain. People are losing their business. People do not have money. And so that's what we've been trying to focus in on Congress, and I'll try to help answer those questions as they come. And so I totally support and understand the needs of people to end this. Mm-hmm. But we have to do it in a way that we don't create a second wave or a third wave or a fourth wave. That will destroy the economy. And so, and the well-being of our nation. So that's where we are. We kind of hit the top of the peak, and we're on the way down. We're stabilized somewhat, but the numbers are still too high. Mm-hmm. The numbers are still, at very high numbers. They are not growing at a rate any longer, but they're not yet. And so I think we're going to wait until the medical advice and the scientists say we have the resources. And the other thing is, and I'll answer questions later on, we don't have the testing yet to know where, to open up, we're going to have to do a lot of other kinds of testing, and we're still not there. We're getting close, but we're not there.
That's right.
Okay. And we're already getting quite a few questions for you both, so that's good. Keep sending your questions. I wanted to ask, you mentioned the task force, Ellen, and I want to ask you, Robert. So the city has this task force focused on reopening the local economy. You've said multiple times that, and you just mentioned the city's following the county and the state guidance on this topic, as well as the data and the science. I'm curious, what role will this task force have if we are following the county and the state for large part? Is there any area where the city could go different or could go a different way?
Sure. I think it's really about partnership with the county and the state. And so because we have our own health department, we can make and chart our own path as long as we're meeting the basic stages and phases that the governor has set out for the statewide recovery. Okay. But we can make different choices than the county of Los Angeles, and we certainly are making different choices than some of our Orange County friends below us. And so we can make those different choices. And so we're looking at a variety of ways of getting input. Our Economic Recovery Task Force, which is led by Mayor Foster, who's also a good friend of the Congressman's as well. We all go way back. He's doing a great job of bringing the people together. That's going to be a great way to inform us, not so much about when to reopen, but how. What are the smartest ways for businesses to reopen, bring in input. That's why we're doing the survey. That's why we have the Hospitality Task Force the City Council established. So we want to get a broad worldview. But then, and all that information then will be shared with the medical professionals and the experts. And at the end of the day, the decision and the final decision on how and when we reopen, getting this input will be made by in my opinion, the smartest people in the room during the pandemic. And those are doctors, scientists, and the statisticians. And so that's where we're headed. But that information will guide us.
So does that mean in Long Beach, does that mean the health department then will be making those decisions, or?
Absolutely. In Long Beach, our health orders at the end of the day are, and it's a combination, right? I mean, some of the orders are recommendations from the health department. Others are city decisions that are made. Mm-hmm. It just depends how, we're all what part of one government system, of course. But we do those in partnership. And so our health department is partnered with the LA County Health Department. We talk every day with the governor's office, with our state partners, and our folks are talking to the CDC, and so it's all trying to move forward together as much possible, but there will be some differences.
Okay. Is it too soon to give any examples of what difference? I know we've been hearing about golf courses and people are really interested in these specifics, personal grooming. We were all commenting on Alan's beard that he's been growing. And people.
I love the beard.
I know. I failed to mention that in my opening. But is there any specifics you can give?
I would say that, like I mentioned before, that we're weeks, not months away from meaningful changes to the stay-at-home order. I think the governor said that as well. I expect soon we'll have some announcements about what these first kind of industry clusters will look like that will start receiving adjustments. But there will be differences. And I give the example that you guys have written about. Take a look at the outdoor bodega market issue.
Mm-hmm.
That was something the county was not allowing. Our restaurants wanted to open up and sell fresh foods and markets in their patios. We thought it was the right thing to do. We pushed it, and then the county kind of followed. And so that's an example of how there might be some differences. But there will be some differences, but you're going to hear very soon from our coalition, Mayor Garcia, myself, our supervisors, and hopefully our friends in Orange County and other places, that we're moving as closely together as possible.
Okay. And you mentioned the issue in Orange County with the beaches, and we actually are getting some questions related to beaches and people still gathering at beaches in Long Beach. But Orange County has been making some news the last couple of days, and Alan, you represent part of a small part of Orange County. What are you hearing from your constituents there? It seems like they've really kind of are fighting back against. I think Huntington Beach filed litigation.
Well, let me answer that in a couple of ways. One, before I get to the specifics about Orange County, and the critical word that the mayor mentioned was partnerships. Mm-hmm. The city is a partner with the county. There are differences whenever there are partners, but you share resources and you figure out what's the best way, and with the state and with the federal government. That's when it works best. The federal government's role in reopening is going to be testing and the assessment. We have moved from what was originally, hopefully, a containment. We blew past containment in the nation to mitigation, just to testing people who were ill, just testing people who had the virus potentially. And that's all we had the resources to do. But to really open, we have to have enough testing in this state and in the nation, and the federal government's responsibility is to be able to help those cities, counties, and states to provide testing so that we can do community surveillance, so that we can not only test people who are already potentially sick, but we know where it is that we have enough people to help us with. Once we get that data to see where the virus is moving, that we can do. Then after we can do that, we can do contact tracing. We can see who they've been part of, and we can begin to isolate people. Then we'll really begin to be able to open up, because we'll be able to open up the economy at the same time, not making sure that we don't have tremendous upheaval. So when I get to talking about what I'm hearing in Orange County that's different than Long Beach per se, from my residents, the overwhelming percentage of responses are the same. I need stimulus money. Mm-hmm. My businesses need small, the SBA loans. We need the PPP loans. It's hard to get those loans. We need unemployment insurance. That's what I hear from them. From the governments, there's a little different. LA and Long Beach and the state have taken up a role that we're going to let science guide us. I hear more in Orange County from their elected officials, not that they're against that all, but that they don't want to take away people's individual freedoms. They don't want to limit people. They don't want to make the decision solely based on science and medical advice. They really want to respond to the pent-up demand for people. And we are responsive to that too, because we don't either. But we're going to make our decisions, as the mayor said, based upon science. And from my elected officials in Orange County, there's less of that. They're more responding to the need to move forward. And we all want to move forward, but we want to do it in a more conscientious, guided way.
Yeah, I mean, and I know we heard from the beginning that reopening was going to be more difficult than closing, and it seems like that's true, especially
That is
right
true.
now.
That is true.
Um, so we have a lot of questions, as you would expect, about small businesses and how detailed are the requirements going to be for businesses to allow them to reopen to the public? How detailed are the requirements going to be? So I think that means probably for you, Robert, what types of restrictions might businesses face in order to reopen?
Yeah, I think first it's important to know that for businesses that the governor has laid out a 4-stage plan. So the 4 phases. We're right now in phase 1, which is all about testing and preparedness. It's being prepared. Hospitalizations, do we have enough PPE? Do we have enough hospital rooms? Do we have enough testing? So that's where Long Beach is at right now, and we're doing pretty good on that. There's still challenges, but overall, I'm feeling great about the team. We are now transitioning into stage 2, which is what the governor calls low risk openings. And so we are identifying within low risk openings, what are the clusters of businesses that are in the governor's guidelines that we think should go first, based off of the best medical and professional advice. And so very soon, we're going to have some announcements about what's in this cluster. And the governor has already given kind of broad strokes, right? He's talked about outdoor recreation. He's talked about some small retailers. And so that's what you're going to be hearing from the city. And when we put out the information about what's next, we're going to do 2 things. One is we've already heard, I think we have something close to 9 or 10,000 surveys back from a survey that we did from businesses. So we have some great ideas there. We're going to put out some guidance on how to reopen for a business, but we also expect that the small business owners are going to have some of the best ideas. I've talked to, for example, folks that own a grooming salon or someone that has a coffee shop. Their ideas on how they keep people safe are the best ideas because they're thinking about it constantly. So it'll be a combination of those things, but we are going to put out a lot of guidance. I think folks should expect over the course of these next few days and week, there's going to be a lot of information about what comes.
Okay. So within the next few days or week or a week?
I don't want to put it, I just think that we're going to continue over the next few days to put more information out. And I think people can expect, I know that everyone is looking at that May 15th date, which is our stay-at-home order date. So we're going to put information out, of course, sooner rather than later on kind of what's next.
Yeah, because so.
Can I jump in and add
Yep.
thing, Melissa? I agree completely with, and I think that Long Beach is doing it in a very thoughtful way. But the other part of the puzzle that as we reopen, is going to be in terms of education and childcare. Yes. All our children in the state are home with their parents. It's very hard to get our parents back to work while our children are still at home at that point. And so it has to be coordinated to some extent at the state level to making sure that we can provide resources for childcare, safe ways to doing it, and begin that planning as cities open up their city to figure out how are we going to get kids back to school? How are we going to do it in a safe way? How are we going to make sure that our schools don't become petri dishes for new viruses? It can all be done, but that's going to be the partnership between the cities, businesses, and the state, and also our education departments. And so we have to fit all this together.
That's right.
Yeah, that's a big issue. I know every time we post stories about the schools or education, people are very interested in those topics. This is one that probably both of you could answer. What does it mean for people who work in Orange County and live in LA County if OC relaxes their orders, but Long Beach remains more restricted? We're obviously extremely close to Orange County. And I know some people who went to the beach this past weekend in Orange County. So is there any guidance for going back and forth?
Well, I think we don't want to, let me just jump in and answer one. I don't think I want to overemphasize the differences between Orange County and there are some openings in Orange County that we don't feel yet we're ready to do that. The beach is another. But in general, Orange County is operating under the same orders to stay at home as all the parts of the state are. So I don't want to overemphasize that part. And we will not see tremendous differences. It may speed up first in Orange County more, but then that's also going to give us a sign of whether it's working or not. And I think that's what we're looking at in some of those states that have already opened up already. Is there going to be, Texas had their largest number of cases this week, and yet they opened up, So we're going to be watching that because this will be instructive for all of us.
I think that's right. I think we're an interconnected state. Folks work everywhere. And so I'm very interested in what happens in Orange County. I think that, well, first, I mean, there's we all have a lot of friends down there, know a lot of great leaders, community members over there. And I've been actually talking to a lot of leaders within Orange County, including some great folks in Westminster that I know well, in Huntington Beach, Costa Mesa, closer to home. And so in talking to some of the leaders and folks there, it's not just about the stay-at-home orders. I think the congressman's right. I think there is some general alignment. We want to make sure that people feel safe, that they're getting access to healthy foods. And so we're all in partnership, just trying to support each other. But there really aren't. I mean, these borders don't really exist. People are going in and out. So the safer we all are together, I think the better we all are.
Yeah. And we're already at 1:22 here. So I just want to remind everybody we're here with Mayor Robert Garcia and Congressman Alan Lowenthal. So we have maybe about 10 more minutes. We'll go maybe a little over. So if you have questions, submit those on our social channels. So this is a question for Alan. With so many families unable to pay rent now, will you support the legislation brought forth by Representative Omar to cancel rent as a co-sponsor? It's worded kind of funny there, but do you support the legislation brought forth to cancel rent?
Well, I think the point, what I support is what we've done here in California. Many of the cities is to suspend some of the rent payments, to work out. We have ways that we've done now in terms of both mortgage payments through people who have federal mortgages, also renters, that they can suspend it. Nobody is getting a get out of jail card free, but you don't have to do it now. You may not be able to pay the rent for 3 months, 6 months. We want to protect those folks, but at the same time, make sure that at the end of the day that the landlords don't go under and lose that, because they have payments to make also. So I think we're trying to provide at the federal level, and we will be seeing that more in the second act, with the next CARES 2 Act, to deal with issues around housing and homelessness and people who've lost their house because they can't afford the rent, to make sure that we keep people in their homes, whether it's Representative Omar's or others, which I support, that the federal government has to deal with this issue. But I think what we're trying to do is support those actions that local municipalities have done to make sure that people do not lose they have to be evicted now. But at some point, we are going to have to protect the landlords too as it goes down the road. And we are, by making sure that their payments also are they're given forbearance now. They can get up to 180 days if they have a federally backed loan, and about 70% of the mortgages on these buildings are federally backed. And so they get forbearance also. And I think that's what we're trying to do, rather than just remove it, to protect them, give them a long time, work that out between the renter and the landlord, but not have evictions.
Okay. So we have a question for you, Robert, about nursing homes. And this was a question that we got submitted. Most of Long Beach's positive case, or not most, but about 30% of the city's positive cases have been associated with nursing homes, and about 80% of its deaths. Why was the city so reluctant to release the specific names of the nursing homes where these cases were? And I have a similar question for Alan after.
Sure. I don't think the city was necessarily reluctant was the word. I think that there was obviously a statewide standard that was in place. And so the medical doctors at the health department wanted to follow the statewide standard, which is based in large part on what the CDC recommendations are about privacy laws around health. So health privacy laws are very complicated, obviously. And so that's where the medical staff was. Obviously, when LA County decided, we know what, we're going to go one step beyond that. our medical staff were like, you know what, this is the right thing to do. We need to go one step beyond the recommendation, because I think that right now it might be that LA County and Long Beach may be the only two, or certainly a minority in the state that is actually releasing as much information as we are as it relates to nursing homes and some of the retirement homes. I think that's the case. And so I'm glad the city's doing that now. I think I called for us doing that even before it happened. And so I'm glad that's where we are now, but it's a very serious issue, and it's really tragic and horrible to see what's going on statewide, obviously, and here in Long Beach.
And Alan, the question along those lines, and obviously people, imagine if you had a parent or a relative in one of these homes, you'd want to know where the cases are. We've got a protest happening down the road here at Terminal Island, which has had more than half of the inmate population over there now has tested positive. There's been 5 deaths. Families are not happy that they're not getting information about their loved ones who are incarcerated. Can you, I know that's not in your district, but can you comment on that?
Well, members of Congress are also unhappy that we're not getting information. You're absolutely right. I think what you're indicating is that the federal prison on Terminal Island, which is in Congresswoman Badagon's district, has the highest numbers of inmates and also staff testing positive of any federal prison in the nation. 60% of the inmates. We're talking about huge, huge numbers there. And we've tried to get that answer. Senator Feinstein and Congresswoman Badagon have led the effort with the Federal Bureau of Prisons to get them to release this data of what's going on. We have been in contact with the penitentiary. Also, we have not received any additional data, but we're hoping that we will begin to see that, and we're very supportive of the leadership of Badagon and Feinstein on that issue. I think what you're seeing is that, and what the Federal Bureau of Prisons say is that they have done more testing in their prison than in any other prison, and that's why the numbers, and that if we were testing other prisons as much, there would be high numbers. And to the nursing home is that this virus does not attack everyone equally.
Right.
If you have an underlying condition, or you live in those kinds of living conditions where you're packed together, or you're elderly, and even the ones that have the fatalities in the prison tend to be the older prisoners.
Right.
They're more at risk. And so we have to come to grips with that. What the prison has done is create tents outside to try to separate the prisoners as somewhat, but we need answers. And we've only had one call of someone in our district, and we've now begun to study that and act as their advocate to find out more answers on it. But it is the same issue that is with you have people packed together. They were not prepared. We were not prepared for the spread of that, and that we're seeing that across the state and across the nation.
Yeah, and prisons are obviously a little different because you can't just pull your relative out. You're very much reliant on.
That's right, and the Federal Bureau of Prisons may have made a critical mistake along the way. We're going to have to do oversight on that, because they did not have the prison guards wearing masks at any time. They thought that would scare the prisoners. They didn't want to have them wearing masks. A very silly mistake.
I want to be respectful. Most of the questions I'll say we're getting have to do with small businesses and reopening, and when, specifically the when part of that. I mean, people really want to know when, and I think people are really, they want some certainty. So I don't want to keep asking the same question, but Robert, if you owned or ran a business that was maybe classified as a phase 3 or phase 4, in terms of the timeline of reopening, what are you supposed to do? How would you plan?
I mean, first of all, I can imagine, it's incredibly frustrating. If you are in one of those phases, it's horrible. And I think what's happening, of course, is horrific and devastating for small business owners and employees and workers. And I think that's important for us to recognize. I want folks to know also that the governor's framework, the city can't go beyond the framework. And what I mean by that is if someone is in a phase 3 as laid out by the governor as a business, we can't open that tomorrow, even if we wanted to.
Okay.
And we have to go through the kind of phase approach. Now, within each phase or each area, certainly cities can move at different speeds, and there will be differences as to which sectors or which businesses are open. But we do have to follow the sequencing. That's a statewide order. And so that's what we're doing right now. Is we are going. What I like to say is the more that we follow the directions that we're giving of staying at home, being safe, wearing masks and face coverings, the sooner we're going to get through this and get a better handle on what's going on. And so we want to get to phase 2. We are there. We are almost there. And I think there's going to be a huge sigh of relief when we start reopening some of these businesses or activities.
Mm-hmm.
But I want to caution us that we still have a crisis that's going on right now. The congressman is absolutely right. There is a plateau, but if you look at the hospitalizations, for example, our hospitalizations today and yesterday were higher than they were a week ago, and were higher a week ago than they were 2 weeks ago. And so while it's not huge jumps, there is hopefully a leveling off of this curve that's happening. But it's still serious. People are still dying, and which is why we're being cautious and erring on the side of being cautious.
I'd like to add one thing to it. Besides when I mentioned that those who have underlying conditions and those who are seniors are more at risk, we know that this virus has disproportionately affected people of color, low-income communities, low-income businesses. And the role of the government in terms of helping those businesses that are not opening is to try to make sure that they get PPPs or loans that will keep their workers working and allow them to pay the rent and allow them to stay open while we're going through this horrible crisis. And we've learned that many of our small businesses, when we did the first go around with this, they never could access their banks. Their banks said, well, we're only going to deal with those. They didn't say it publicly, but they dealt more so that I already have a business arrangement with. And we realized that we had to make sure that there was separate money that was set out for those businesses that don't have bank relationships with banks, that really are the mom and pop shops, the ones that are the most affected. They don't have the resources in the bank to get through this period. And those that we've dealt with, those community bank or those banks that really need to go through community banks, credit unions, banks that are embedded in the community. And Long Beach has done a really good job through their Economic Development Corporation to tie those businesses to the National Development Council, which allows them to access resources from banks that typically only do business with those small banks. So it's not only when they can get up, it's that now when they can open, it's that we provide them help now for those that are most vulnerable. And we are seeing with small businesses, the ones that are most vulnerable are the ones that have that are just those, the mom and pop businesses that are the backbone of our community. They found it the most difficult accessing our SBA loans and our forgivable loans. We're trying to work on that, and we just were not prepared as a nation to deal with the scope of this problem.
And I'll add also to what the Congressman's point is, we can't do this without the help of the federal government or our state partners. So cities and municipalities are set up to do certain functions, and our budgets reflect those functions. But at the end of the day, large interventions to rescue our small businesses has to be done at the federal level, which is the work the Congressman is involved in right now. We know what's happening with unemployment. That's being handled in also at the federal, but the state level, and money is going to our states to help with some of that. But we need more of that support. I know the Congressman's fighting for that. Our small businesses need much more support from the federal government, and I know that Congressman Lowenthal supports that position, and so that's what they're working on. And we hear you, and the city has microloans. We certainly are putting the money that's being funneled down through the SBA. We're assisting in getting folks access to that. We're connecting people to the SBA small business loans, to microloans, but it's just not enough. And so we're continue to try our best to get more resources out there.
Yeah.
And we also have to make sure that we provide additional resources to the community health centers, to those health centers that really do the outreach and work in our communities, not just the major hospitals. And that when we get money to the hospitals, our first tranche of money that went out to hospitals went to those that had the highest Medicare census. Well, that's all well and good, but the really biggest problem were the Medicaid and the Medi-Cal, the poorest, the hospitals that rely upon the poorest members of our community, the least of the most vulnerable in our community. And yet we did not get as much money to those hospitals as we did to the other hospitals. So we're just learning, but we've got to do more as a federal government, and we will be doing more.
Let me see if I
And the
can.
last thing is we have to give cities and states much more money. We're talking about much more money. We are about to look at what happened. California in 2019 had a surplus in $20 billion or more money. This past year, it was down to, in January, 10 billion or 8 billion. It's going to be billions and billions of dollars short, and it's not going to end today because those resources are not going to be coming in. The federal government has to be a partner in the future. And we talked about a $2 trillion last one on the CARES, which was only $100 billion to cities and states. And we're talking about the next one being almost $1 trillion for cities.
I know
so we're talking about massive amounts of resources.
I know that's been a point of contention. I just want to get in one more question that we're getting that's hopefully a quick-ish answer for Robert. When will the eviction moratorium be extended?
I think the city council is actually looking at that right now.
Okay.
And so I understand that there's council members talking about that. And so I'm supportive of extending additional support for renters. And I think the congressman talked about on the other end of that, making sure particularly small property owners that need to ensure that they pay the mortgage as well. It's a holistic view at that. So we're working on that. And I absolutely support more renter support. So that's got to happen.
And it's we're going over. I just want to give you guys a chance to give any closing thoughts, and we'll start with you, Alan.
Well, I think the last thing that the mayor said, or just before that, the federal government's role is to coordinate resources to make sure that those cities, those counties, those hospitals, those small businesses where they're most impacted, and especially in businesses that have difficulty accessing loans, that we get the resources to them. We did not understand, we were not prepared for the severity of it. And the last point is, this is not going to end even as we open up our businesses tomorrow, the next month. We're talking about until we have a vaccine or effective treatment that this is going to go on. Hopefully we will have those within the next 6 months to a year. But we have to be alert. We have to maintain social or physical distancing. No matter what we open up is going to have to be the mantra. We do not have any other treatment. We can only stop this virus by making sure that we take care and that people that we interact with, we do not infect them also.
Yeah, I think that's right. And I'll just say that I'm reminded also during this town hall that, partnerships are really important. And I want to thank, the congressman for his work representing Long Beach and Orange County in Congress. And here's an example. I think early on, before the first CARES Act came out, Congressman Lowenthal, we're talking constantly about what the need is. The direct payments to residents that came through in the first CARES Act. That was one of the first things that him and I spoke about the importance of that. And we both support that continue. We need to have our residents, one check for $1,200 is not going to be enough to keep people going in the future. And so those are the kinds of issues that we're both advocating for. And I think that we're lucky to have him as a representative. I would just conclude by by just saying that please know that what's happening here in Long Beach, a lot of our success is going to be dependent on our ability to have these relationships and these partnerships in DC and Sacramento, and we're grateful that they're strong, and we'll continue to work on this together, and have some hope, because I think that there is good news on the horizon and on the way very soon. And I'm just grateful to everyone for in this community for being, I think, very supportive of the city. So thank you.
Yeah. And thank you both for taking time to do this event. We hope to have one or both of you back if you're able. So Congressman and Mayor, thank you. I know the mayor's running off to his 3 o'clock media briefing today. So, and thank you for watching. If you didn't get your question, I know we got a lot of questions that we didn't get to, but we will do our best to get you answers to those questions, and join us next week, 1 o'clock. We do these every day for about a half an hour. So thanks for watching.
Thank you.
Thank you.